Next presenter is Dr. Gail Frazetta. You can always count on her to use the word uterus in her presentation, Jenny. She's a family practice physician from Montrose, and she specializes in osteoporosis and hormone therapy for men and women. She's presented before at Ignite. She is a fascinating human being. Gail, come on up.
Thanks, everyone, for being here tonight. I will be using medically accurate words, so in case anyone is it's potentially a little bit cringeworthy for some, but they'll be accurate. Tonight's presentation, hysteria. So it's a word that originated in ancient Greece, so 4,000 years ago. It is derived from the word hystra, which means womb. So when you look at that amazing array of things that are listed there, they all can be traced back to the womb. They were given scientific and demonological connotations, but they have one thing all specific for females and females alone. Anything basically men found mysterious or could not explain became hysteria. It could range from kleptomania to a fever. These fine scholarly gentlemen believed that all of women's ailments were due to the uterus that migrated around the body and pushed on other organs, causing their maladies. The bully uterus, migrating around everywhere, causing hysterical suffocation to women. You could fix this, however, if the uterus was riding too high. You could put foul-smelling things towards a woman's mouth, have her sneeze, and it would get corrected. Or do the reverse, put foul-smelling things in her vagina, and it would correct that way as well. Mesmerization was popular in the 17th century, probably better than being burned at the stake as a witch. However, men apparently had these secret powers. I must say, I do feel that way sometimes when I'm buying shoes. I might look like that. Jean-Martin Jacquot was the founder of modern-day neurology. He had created a whole ward in a hospital for non-insane women. He had 3 very important women in his lives who helped with that. One is he married a very wealthy widow, and he had 2 women who basically became very popular, who were showcased at these spectacles that he had essentially for medical students. The women would essentially be induced into hysteria epilepsy. And interestingly, Freud at the time was a medical student of his. So one of his most famous was Augustine. Augustine was admitted to the hospital at age 15. She was incessantly photographed at that time, remembering it's the 1880s, often scantily clad. She was the embodiment of hysterical ecstasy. She basically was a star of the show for about 5 years until she basically refused to stop being photographed. She was then sent to solitary confinement within the hospital, where thankfully she escaped disguised as a man. Her backstory, however, is she was molested at age 10, raped by her mother's lover at 13 via razor point, and harassed by the neighborhood men. So that was his star subject at that hospital. The hysterical paroxysm would be created. This would help somehow women be cured miraculously. Was this hysteria, a seizure, or a really great orgasm? Hard to say, because uterine massage was one of the treatments of choice. Simultaneously at this time, you had a Canadian psychiatrist performing hysterectomies on women to cure them of their psychological illness. So essentially, the hysterectomy became a lobotomy. Freud. We have a lot to thank from him. Yes, women lamenting or being shocked and traumatized that they don't have a penis. And then, to cure that, you have to either marry one or give birth to one. He actually, as I mentioned, was a student of Charcot's. The vibrator. Yes, it's an appliance. It really did not have a sexual connotation. You could use it to improve your skin, treat anxiety, a headache. The sexual connotation was obvious, but these maladies that women had were medical problems, not psychological, so this was the treatment. This gave rise, finally, to the American Psychiatric Association saying that we're not going to use the word hysteria anymore. Well, that was great. They voted on it in 1930. It was not removed from the psychiatry manual until 1980. So up until that time, you as a female could have had a diagnosis of hysteria. The uterus is, in fact, a magical organ. The uterus can take a joke. It is like no other organ that we have. Men, certainly not men, but for women, it's phenomenal. It can actually act as a transporter, takes a couple of cells, makes it into a human being, and transports it to Earth as a human being. Beam me up, Scotty. The uterus, as the most resilient organ, basically grows from its size of about the size of your hand 20-fold to accommodate a full-term pregnancy. It does this, and then after delivery, it has to miraculously contract to mostly its normal size. Otherwise, the woman would die from bleeding to death. Imagine, to give you a different image, a men's testicle going all the way down to his ankle, containing a 10-pound bowling ball that then got stomped on, called labor, every 3 minutes for 8 hours. Lets a human come out and then retracts to his upper thigh so that you and the rest of humanity doesn't die. Pretty amazing organ. So, when someone tells you to grow a pair, you should grow a pair. And, of course, don't forget the magnificent migratory uterus. Thank you.